Today, I am doing a presentation on psoriasis. It is a chronic skin condition in which the body's immune system attacks its healthy skin cells, which leads to scaly, inflamed patches. It occurs when the cells replicate every 3 to 7 days, and the autoantibodies attack the skin. Psoriasis affects adults in various races and ethnicities, is related to smoking and obesity, and typically shows between 20 and 30 years old. Men and women are equally as likely, but family history certainly increases that risk. Pathophysiology. Psoriasis is a chronic condition that leads to rapid growth of skin cells, resulting in thick, silvery scales on the skin, which the exact cause isn't completely understood, but we believe it is triggered by a combination of genetic factors and environmental influences and an abnormal immune response in the skin. The development of psoriasis involves the overproduction of keratinocytes, the dysregulation of the immune system, new blood vessel formation, angiogenesis, and the action of inflammatory mediators. This abnormal immune response leads to psoriasis, specific skin lesions, and symptoms influenced by a genetic predisposition and environmental triggers. Risk factors, modifiable risk factors, stressful life events. Cortisol levels are low in people with psoriasis, and they're very sensitive to stress, and this causes more inflammation and overactive immune response. Obesity. Obesity changes the makeup and behavior of the inflammatory cells in the skin. Skin injuries. Koebner phenomenon. It is a inflammatory reaction brought on by skin damage, such as a cut or a scratch, that can compromise the skin barrier and cause psoriatic lesions. Non-modifiable risk factors, genetics. Research shows that genetics significantly contributes to the risk of psoriasis. Their heritability estimated between 60 and 90%. Ethnicity. Studies show that Caucasians are higher frequency of psoriasis than African Americans, Hispanics, and Asians. Advanced age. Aging causes skin changes, which increases inflammation and psoriasis risk. Immunosenescence, a weakened immune system, causes inflammation and worsens psoriasis symptoms. Major signs and symptoms. Plaques. Thick, elevated skin regions often covered in silvery white scales. Patches of thick red skin with silvery white scales are usually found on the elbows, knees, and scalp. Trunk, palms, and soles of the feet. Nail changes. Pitted, fractured, and crumbling nails. Discoloration. Skin patches may be pink, red, brown, purple, or gray. Symptoms. Itchy skin, particularly in the patchy areas. Pain that is described as stinging or burning, especially when the rash is scratched. Bleeding. Breaks in the skin causes bleeding, especially when the rash is scratched. Poor sleep. Physical symptoms like itching, they worsen at night, and as well as the body's ability to regulate body temperature, which because of skin irritation, making it hard to fall asleep and stay asleep. Diagnostic testing. Dermoscopy, non-invasive using a dermoscope to zoom in on skin lesions. This helped closely examine the small blood vessel patterns typical for psoriasis, and which is helpful in cases affecting the head, nails, and genitals. On confocal microscopy, a modern imaging method that creates clear pictures of the skin layers. This method can help tell psoriasis apart from similar looking diseases. In the psoriasis area of severity index, a standardized scoring system that assesses the level of seriousness of the lesions by looking at redness, scaling, and thickness. This method helps track treatment's effectiveness. Laboratory tests. Skin biopsy. This is considered the gold standard. A tiny sample of skin is analyzed under the microscope to assess the histological aspects of psoriasis, such as acanthosis and parakeratosis. Genetic testing. Genetic testing is not used for initial diagnosis, but can find specific gene changes and increased risk of developing psoriasis, especially in the HLA-CW 0602 gene variant. Inflammatory markers. Some blood tests like CRP and SUD-rate can show the levels in people's with severe psoriasis. This suggests that there's inflammation in the body, but is not specific to the diagnosis. There's also emerging research on biomarkers. They are looking for signs in the blood, such as proteins and molecules that show how active psoriasis is and how it can help create a better, less invasive way to diagnose the illness. And here are my references. Thank you.